Are you struggling with neck pain due to a slipped disc or herniated disc, or maybe your doctor told you that you have a ruptured disc in your neck and you're having some neck pain and maybe even some numbness and tingling into your hands? Are you wondering what's going on, what caused this problem, what to do about this problem? Well, in today's videos, we're going to be talking about all things cervical disc. So what a rupture and a herniation or a slipped disc is, how they are structured, and most importantly, what you can do about it. Ready? Here we go. So the first question we want to answer is, what causes these disc problems? Or maybe you're even wondering, what are the discs? So in between the vertebrae, throughout our spine, from our neck to our tailbone, we have discs. They're these flat, kidney-shaped structures that help to transmit force from one vertebrae to the next. So the vertebrae don't actually bend or twist or move because they're bone, so they're pretty firm. But the discs help to transmit that force from the top of our head to the tip of our tail, which means they're pretty flexible. The discs are built with multiple layers that lay on top of each other in kind of a diagonal pattern. It's kind of like a Chinese finger lock, and so when you rotate, in this case, or pull your fingers apart with a finger lock, the discs tighten, and that helps to squeeze out all the waste products and things that are made in the disc. And when you bring your head back to neutral, or bring your fingers closer together, it's easier to pull your fingers out of the finger lock. And with the discs, that allows them to bring in nutrition. So they're kind of like sponges in a way, where when you rotate to one side, it wrings it out, and when you come back to neutral, it pulls all of that back in, because they do not have direct blood supply after the age of 20 or so. So if you're having disc problems, most likely you're older than 20. Before age 20, they actually do have direct blood supply, and it's way easier to get the nutrition they need. However, chances are good that if you're having disc problems, you're over 20 years old, and that's why you're having these problems, is because it's not bringing out and absorbing new material correctly. Now, what can happen is over time, if there's too much abnormal force, so maybe if you do something where you're looking down for a prolonged period of time or looking up for a prolonged period of time, maybe you do an activity that causes a repetitive motion in your neck, and that's what's caused this problem for you. Or you may sleep in a bad position, or you may have been involved in a car accident. All kinds of things can cause that disc to either herniate, which means there's kind of a bulge in the disc, so part of it's pushed out beyond where it should be, or it ruptured, which means that bulge kind of opened up, and now you've got discal material that's supposed to be inside the disc, but it's outside the disc. Now, some people refer to this as a slipped disc, and I don't feel like that's the most accurate term, because your disc can't really slip out from between the vertebrae. It can bulge, or it can potentially have discal material outside of the disc, but that doesn't mean that the disc has actually slipped out. So the disc is going to stay where the disc is going to stay, which is in between the vertebrae, which is also where we want it. However, it can bulge out or even rupture. The challenge with this is that it doesn't necessarily just cause neck pain. It often will cause a numbness and tingling sensation into your shoulder, maybe down to your elbow and down into your hand. It may be starting with numbness and tingling in the shoulder, and if you have those symptoms right now, then I highly encourage you to get help from a specialist to deal with this problem now. If you wait, it may travel down into your hand, and it just becomes more difficult to deal with. Now, for some people, when that disc ruptures or even when it herniates, it will start with symptoms all the way down into the hand. So if your symptoms started in your hand and you never had any symptoms in your shoulder, that's okay. That happens for some people. Just realize that it's important to get help as quickly as possible, because you don't want to let these symptoms go on for too long. What happens is when that discal material comes outside of the normal disc space, or when it bulges out, it creates an inflammatory reaction that's right near those nerve roots. And the nerve roots that are in your neck go all the way down to your hand. So we want to relieve that pressure or that irritation or that inflammation as quickly as possible so that those nerves can heal and you can stop having symptoms down into your hand. Now, if you don't have an official diagnosis yet, you haven't been to the doctor and been diagnosed with a disc rupture or a disc herniation or anything like that, but you suspect that you do, how can you know? In general, my patients who struggle with disc problems complain of two things. One is numbness and tingling that's gone into their shoulder, elbow, or hand and wrist. And the second one is that they feel like their neck is unstable. So they feel like they can't turn to those end ranges of motion, or they can't look down is the most common one. Sometimes that they can't look up. And it may be due to pain because that disc is a little more flexible than it should be, but it can also be due to feeling unstable because that disc has kind of changed its shape in a way and it's putting an abnormal stress through the other muscles and ligaments and stuff, and it makes you feel unstable or uncomfortable or queasy or painful. So if you experience any of those things when you're trying to move your head, chances are pretty good that you do have a disc issue. How do you know the severity of your disc issues if you haven't had an MRI? You can usually tell the severity either by how far it's gone or how quickly it came on. So like I said earlier, if you have shoulder numbness and tingling, then that disc is probably just a little bit bulging. It's just putting a little bit of pressure or irritation or causing some inflammation on that nerve root, and it's usually not too bad at that point. If it starts all the way down in your hand and it's really numb and tingling and you cannot relieve it by getting into another position or doing anything different, then chances are it's a bigger disc issue because it's more intense and it comes on quicker and it's not able to be relieved. Usually when disc issues start, if you bend your head to the opposite side or do different neck motions, it will again change the shape of that disc just enough to take pressure off that nerve and relieve your symptoms. So again, if you find yourself able to find a position of relief that helps, now is definitely the time to get some help because you don't want it to get worse. If it gets worse, it gets harder to treat and it will just take longer to heal and repair. Now, what can you do to help? The most important question of all. So if you've either self-identified that you have a disc problem or a doctor's told you that you have a disc problem and you don't know what to do, there's one particular exercise that I would definitely encourage, and that is rotation. So rotation, turning your head to look over your shoulder to both sides, is the action, again, that will heal that disc because it's like that Chinese finger lock, right? So you need to rotate and derotate to bring in nutrition so that disc has the materials it needs to be able to heal itself. However, there's one very, very, very key point that I want you to hear. You can only rotate as far as you can pain-free or symptom-free. If you have numbness and tingling into your shoulder, elbows, or hands, the goal is not to reproduce that. You know if you're reproducing that, you're putting more pressure and causing more damage in the long term. We don't want to do that. But what you do want to do is rotate as far as you can in that pain-free range or numbness and tingling-free range. You want to do 2 sets of 15 reps every hour to make sure that you're properly stimulating that disc so it can heal. Now, for some of my patients, they're not able to even get their head into a neutral position if they're sitting or standing because of the numbness and tingling in their hand, wrist, elbow, shoulder. If that's you, then what I want you to do is to lie down on your back with your knees bent to protect your low back and do the rotation while you're laying on your back. When you're laying on your back, it helps to put your neck in that more neutral position, which is where the disc wants to live anyway. And then from there, with your head resting on a pillow or the ground, whichever feels most comfortable and the least amount of symptoms, you can turn and look over as far as you can to one side and then look over as far as you can to the other. Remember to always keep this motion pain-free so you don't have any numbness and tingling or any pain in your neck. If you do cause pain, it'll cause the muscles to actually compress, which actually puts more pressure on that disc. So in this case, no pain, no gain needs to be thrown out the window. You need to move as far as you can pain-free because we want to get as much of that ringing action as possible, but we do not want to allow pain because that will cause compression, and compression will not help the situation at all. Now it's up to you. Let us know in the comments below how this worked for you. If you find these exercises helpful, click subscribe because we're always uploading new ones for you. Have a great day, everyone.